Aging in America is happening fast, and we as a country are not prepared to take care of our elderly. So every day, 10,000 people are turning 65. We are living longer than ever, and our system that's broken is not going to be able to handle this situation. I'm Cherie, Nursing Home Insider, and how do we fix it? I made a video about fixing it, but this is going to be a little different on aging and our stats and other countries and what they're doing. And how do we solve this problem? We're not going to solve the aging problem, obviously. It's just going to get worse and worse for the next 15 to 20 years because of baby boomers. So that's called the aging tsunami. It's more than a wave. So there's in less than 5 years, 1 in 5 Americans are going to be well over the age of 65. The boomers were from 1946 to 1964, so after the war, and I'm already talking to all of you baby boomers. So I missed it by 1 year, and they're all turning 65, 75, even close to 80. So Alzheimer's and dementia is getting worse, and we're going to talk about that in another video. What are we going to do? So everybody's living longer. Are they living healthier? No. In the next 5-10 years, 75% of the people over the age of 70 are going to need some form of care. So, cost. Now, nursing homes cost well over $10,000 a month. Assisted livings, it's all this is relative to where you live. Okay, here in Louisiana, we are on the lower end of things. Other states have very high, especially up north, high cost. So home care, and this is a big deal to me. So $25 an hour, and that's what it should be. So because I was a CNA for years, and when you work for care.com or something like that, an app, and these families will post their jobbing, and they're offering $10 an hour. I'm sorry. If you really want good care, then you need to pay for good care. And maybe you don't have it. I get it. But that's what I'm saying. That's the problem that we're dealing with. Because $10 an hour, McDonald's makes more than $10 an hour. So don't offer somebody that little bit of money to take care of your loved one if you're going to pay for home care. Okay? So then you've got Medicare, which only pays for 100 days in a skilled nursing facility for therapy. They do not pay for long-term care. Medicaid, you've got to make less than $2,900 a month in Louisiana, and there's other stipulations. But you also, if you own a home, and you want Medicaid to pay for you to live somewhere, then you have to sell everything you own in order for them to do that. I had a lady on TikTok ask something the other day because her home was in her name and her mom's. And the nursing home told her she had to sell everything in order for them to have Medicaid. I'm not a lawyer, but I did suggest maybe because it's in both their names that they could look into that. I don't know, but let me just tell you, and we'll make a video later about this, but if you own property and you're older and you have children or grandchildren that you trust, then put the home in their name. It has to be done at least 5 years before you need care. And if it's done 5 years prior, then they can't take that home away from you, okay? But if you're going to need Medicaid, you're going to have to sell everything you own in order to get it. Okay, and then, you go into a nursing home and Medicaid pays for everything, but you get $30 a month to live on. Yes, everything's provided by the nursing home. And if you have no family, believe me, I know this from personal experience in nursing homes that I've worked in. These little people with no incomes and no family, and they get $30 and they smoke. That doesn't go anywhere. So, yes, they could quit smoking, but they don't. It's the only thing they have left in life. So those are not systems that are going to help us, right? Then you have the staffing crisis, which we have talked about extensively, in other videos, okay? Yes, there is something going on in the government that they're working on national standard staffing ratios. I don't know when that's really going to happen or not. I wrote my representative and called my representative. So I'm asking you to do the same. Find out what's going on with that. Because, okay, so Florida, who has like one of the highest populations of elderly people, because that's where everybody moves to Florida. And yet their staffing ratios say that it's okay to have one CNA for 20 residents. And that's so not acceptable. Louisiana, like I've said before, it says sufficient staffing. What does that even mean? That's completely left to the administrators in the nursing homes to decide what sufficient staffing means. So we've got to have regulations somewhere, like 6 to 8 at the most is okay. That's anything else is way too much, and you're going to have staff burnout. You've got staff turnover, nursing, CNAs. And I've never been a TikToker, but I have to say I've been doing TikTok videos and watching multiple CNA videos, and it's really sad to me. And there are definitely some good ones out there. And I did make a TikTok video, and I asked the CNAs to answer questions, why they love their job, what they wish families knew, and that kind of thing. And I probably have over 500 answers. And let me just say, first of all, only the really good CNAs answered the questions. I guess bad CNAs don't care. So that was kind of my point, was trying to get some answers from, people that really didn't want to be CNAs. But I got the ones that really loved their job. And they did complain about the shortage, and they complain that families expect too much of them when they have 10, 12, 15 people to take care of. Then families need to understand their mom or their dad or their husband or wife is not the only person in the nursing home. I mean, that's where the family comes in, okay? And you've got to be there, and you've got to help support. You cannot expect these CNAs and nurses who are understaffed to do all of this, okay? Other countries, I thought this was interesting. So I thought, okay, all these other countries are doing it better than we are, like Japan or China. And so I've been reading about their country. And it was very interesting to me that Japan, who has the largest number of old people and the largest number of people over 100, and yet they still struggle with trying to find solutions. They do have, I'm just going to be looking at this, okay, community-based and home care services. They promote senior employment and community engagement to combat social isolation. And they also, any Japanese, Chinese, any of the Asian population tend to have a lot more respect for their elderly than we do. And that's just a cultural thing. It's a shame. So I read a Japanese article, and that's because, you look up stats and it tells you good things. So I read an article by a literal Japanese medical person who just states that, they're basically dealing with the same situation we are. And elder abuse was found to be more prominent in the home. And, I get those comments that say, take mom home or whatever. That's all fine and good, but there is definite abuse in the home. And so that's a problem because, we had several residents in our last nursing home that had to be taken out of the home because of abuse and put in the nursing home. So, hopefully they're living better there. And so people can say what they want, but there is definite abuse in the home situation. Because families, that's the other thing, families are getting burnt out financially, emotionally. We're all so busy in our lives, and maybe, you started late and you've got kids or teenagers and your mom, and everything is overwhelming. So we're stressed out. We don't have the money That's why people aren't paying $25 an hour for home care. This is a really big deal, and it's really bothering me on how we can fix this. I'd said before in another video how robots could be the future, taking place of the CNAs and the nursing. Now, I don't think they should take the complete place, because I do think that there are some wonderful, compassionate, caring people working in healthcare that are getting burnt out. But however, if we had robots come alongside, maybe that would ease the strain, I guess. So I looked into that. Japan is using robots for companions, and Sweden and Singapore are also using robots for companions and to help with healthcare. I know that they're very expensive, and so, but I would think that would be the initial thing, would be, investing in that kind of care. Just interesting. I would like to know what you think about that, about robots helping. So, what are the solutions? Okay. Now, I have so many ideas in my head. I just don't have the money to fund all of these. And if I can find a way, believe me, I'm going to do it. I've had most of these ideas in my head for several years. I do not think that the government is going to be able to fix it. I don't trust that the government can do that. I do believe that they do need to fix the national standards for staffing. And like I said, that's been working in the process, and you need to call or write your state representative about that. But I don't think that they're going to fix it. So what are some ideas? Maybe you have some ideas. I would like to hear your ideas. The private sector, nonprofits, real estate investors. I mean, those are the people, and maybe the people just have the heart to do this, but private homes for residential living. Now, this is a big wave that I've seen happening, and I've gone to classes on it. I've wanted to do this for a while, and I wanted to do it for the poor. That is a big deal for me. So the people that are on Medicaid and that don't that can't afford $7,000 a month to go live in assisted living, what can they do? Yes, like New Orleans has lots and lots of elderly housing based on income, but there's like a 10-year wait list. I mean, it's ridiculous. So I don't know. And then rural areas, you've got those different kind of issues out in the country, not in the cities. So private homes, maybe, I'm going to buy some homes and have 5, 6, 8, depending on the house and depending on whatever, and have them split the cost. Well, they would pay me a certain fee, but that would split the cost of everything over, the electric, the water, the mortgage, all of that. But that's a small solution to this huge growing stat of Americans that are going to be needing care. So then you've got big new living spaces like, malls have gone out. They're out. And they're sitting empty in lots of places. I think they should be turned into senior living communities where you have everything under one roof. You even have dementia care or a daycare like that for dementia patients. You have gyms, grocery stores, movie theaters. Make it look like a place that they grew up, everything under one roof. And that's all that they would need. Maybe granny pods is what they're calling them now. Those little small houses. Maybe you can put one on your property for your mom or your dad or whatever. And then there's, they call them like 55 and up senior communities, where they're putting a whole bunch of those little pods together and creating a community. And that's an idea. And maybe you could even work healthcare into that somehow. On-demand care apps, which has really got me thinking. They were talking about Uber for on-care. I know there's care.com, like I said before, but and then there's probably some others. But like in Japan, they said if you're out in the rural area, they can pick up the phone and dial a number and someone comes right out to them, like a home care thing. I don't know how that was paid for or whatever. I'm just saying, so if you had, people that are living on their own, which, more and more people are wanting to do that and are able to do that. My parents, for example, and there's their beautiful picture, 80, 81, and they're acting like they're 55 or 60. I mean, I can probably not even keep up with my mother. So we're living longer and taking better care of ourselves, hopefully. Well, I know that's not really true because we're all on medicine to make our symptoms go away, but that's a whole nother video, and I'm not going to go into that right now. But my parents, as you see, they are extremely healthy, but she's lived healthy. They exercise, they eat right, and do all the things that you should do to stay healthy and take care of themselves. So these are just some solutions. Do you have more ideas? Please let me know. I mean, this is a hard issue for me. Like I said, of course, my parents who are so healthy right now, I don't really think about it. In-laws and in-law grandma, me. I mean, I'll be right there myself, as will you. No matter, time goes by so fast, and aging is happening fast. It's just a fact. And we aren't prepared is a fact. And we have to have solutions in place as America to be able to take care of this tsunami that's coming. So it'd be no different than a physical tsunami coming and just washing us out. I just can't, I don't know what that looks like. I knew somebody one time that, thought we should just kill, it's like the whole genocide thing. Just kill the older people and you don't have to worry about taking care of them and that kind of thing. Oh my God. But the older people get, I guess, obviously you're going to change your mind about that. So please subscribe and like and comment and help me out as we try to come together and create some solutions for this huge problem. Okay? Thank you.